In today's Focus on Dentistry, let's talk about TMJ problems. Headaches, noises in your joint, perhaps pains in your joint, and pain in your jaw. Hi, I'm Dr. Paul Henny, and let's spend a few minutes talking about the issue of TMJ. TMJ problems affect roughly 40, perhaps even 50% of the population based on some surveys. Fortunately, a lot of people that have TMJ problems can adapt to them, but a certain percentage of people cannot, and they have chronic problems with their jaw joints or their muscle system, or even the way their jaw joints function totally. Let's spend just a few minutes talking about what TMJ problems are, so you can get a little more familiar with that topic and perhaps determine whether or not this is an issue that you have or not. The TMJ, to begin with, really is a broad term. It really represents the temporomandibular joint, which is obviously the jaw joint. Problems with the jaw joint, TMJ problems, or sometimes it's called temporomandibular disorder, are really what people have issues with. And those problems can be related to the jaw itself, to the jaw joint, how the jaw joint functions, or even the muscle system that moves and supports this whole system. For instance, on this other model, we diagram really where all the muscle systems actually begin and end. You can see there are a lot of muscles in this area. Up in this area is called the temporalis muscle. Up in this area is called the masseter muscle. And there are several others in this area that are involved in the issue of TMJ issues. So it's a complex disorder, and it can involve more than one thing. And the key thing is to get a diagnosis, to try to figure out what's not working right, and then from there figuring out some plan of action that will get things settled and get things comfortable again. One of the more common things that can happen with a TMJ joint is that we can have a disc that can come loose, either partly or totally. It can dislodge and roll off, and that will turn into a click or a noise in the joint, in some cases even locking up of the joint. So this is one of many things that we need to evaluate when we're looking at a TMJ problems. The best way to begin to evaluate a TMJ problem is to align yourself with a doctor, a dentist in particular, that has appropriate training in this area, and there aren't that many really that have studied this and who are proficient at it. I've been practicing in the area of TMJ for almost 30 years now, and my training has been at all of those institutes I previously mentioned, at Piper and Dawson and at Spear, as well as the Pankey Institute where I taught. So I would invite you to give me a call if you have some questions about your TMJ problem. We'd be happy to sit down with you and discuss it and see if there's some way that we can help you. Thanks for visiting with us.